This is Talk Business and Politics with Roby Brock.
And good Sunday morning to you. I'm Roby Brock. We appreciate you tuning in. There was plenty of big news this week in business and politics, but we start at the state capitol. Several votes to end the private option were taken. The final result, a bill to end it in 2016 versus 2015, advances. The governor's tax cut plan clears a House committee and a House vote. Joining me to talk politics is Senator Missy Irvin. She's on the Senate Public Health Committee. She's the Vice Chair of the Joint Budget Committee, and you are also the Chairman of the City, County, and Local Affairs Committee, among other titles.
Thank you.
And Representative Jett, who is the Chairman of the House Revenue and Tax Committee, and I'll let you pick whatever other hat you want to.
It just depends on the day, I think.
It does, anyhow. But anyhow, thank y'all for being here this morning. I appreciate you very much.
Thank you for
All
asking.
right, let's begin with the governor's tax cut vote on, I believe it was on Thursday before you guys left for the week. You had the passage of the bill that has a 40% capital gains exemption, and it passed in the Senate with a 30% gain. Where's this thing going to kind of finally settle out?
I think we're going to see where it settled out right now. I mean, I don't see any. It's going to go back to the Senate to concur, and from what I'm hearing from my good friend Jake Falls, on that end, he thinks it's going to come out, and I'll let my good friend Senator here discuss that on the Senate side. So
I think it's really a reflection of the great amount of cooperation that's being demonstrated right now with the executive branch, with the Senate, and with the House. I mean, you can look at this piece of legislation and look at the process of how the legislative process works, and it's really a great, beautiful picture of how that works. You start with something, you start with a proposal by the governor, by the executive branch, and then it moves through the Senate, and then it goes down to the House, and it changes a little bit more, and then it comes back to the Senate. So it's a great example of a really spirit of cooperation that is really occurring right now. I think there's so many of us that understand that we're trying to help the families of the people of the state of Arkansas. And so in order to do that, you've got to figure out what works, and it's just a constant give and take, and you end up with a better result.
You guys are on your honeymoon period right now. Trust me, the grenades will come before this session's over. So
I've been there with the grenades.
All right, let's move to the governor's budget. You guys are both obviously involved in it. The tax policy has a big part in that. The governor presented his balanced budget this past week. There was basically some increase in funds for Medicaid, for education, and for prisons, although I want to come back to prisons on that. What do you want to see changed? The legislature gets to set the budget. It's the governor's recommendation, so you guys get the final say. So what did you like? What do you not like? What do you want to see changed in the proposed budget?
I like the increased funding to the foster care program. I think that's extremely important. And so he didn't do an overboard approach. He really looked at specifics of where he wants to concentrate and put extra funding in places that he knows needs it. And foster care program in Arkansas is one that really, really needs it. So I liked that part of it. I think there's still going to need to be some addressing of county jail reimbursements and corrections as we move forward. But all of that really needs to play out with how we end up with tax cuts and the rest of the policy to be considered all together.
And there's still plenty to go. What do you want to see?
Well, when we look at it, the higher education is going to be flatlined. So I was, very, very glad to see that higher education was not going to take a cut. And then plus on the bottom side of it, 1% cut in state agencies. So when we looked at the budget, we was talking on the tax cut issues, if you will. We didn't see any kind of slash and burning, and everything was done to me in a responsible manner. And as long as we do, we can have our disagreements, but as long as we work things out, as the senator said, in a responsible manner, I'm all good with that.
Well, let's come to prison funding, because there was not a lot of money in there. I think there was about $1 million increase. There was some more money for the county jail reimbursements, but you guys have a big policy series of decisions to make in terms of how to handle the overcrowding situation in prisons. What's being discussed behind the scenes as to what might be done? It's obviously not going to be a $100 million new prison. What is being discussed behind the scenes, and where does the funding come to support those changes?
Well, I think, the county jails, we went from $28 a prison to the county back to $30, so we bumped it up $2, which is not a lot, but it's going to make a difference. But I think where you want to see this thing play out is the tax cuts, private option, and that's going to be the third big thing that we're going to take care of before we leave. So, but I think at the end of the day, you have 135 of us, and right now I think you're going to have 135 different opinions. That's how this thing's going to play out until we kind of start getting past these other two issues, and then we'll start having meaningful talks.
Which is probably part of the reason why there's a big push to get the private option and the tax cut bill through early in the session.
I think that's so responsible to do it that way too. Before in sessions past, we've had this, constrainment of these big issues kind of looming at us, and so it takes away attention from really trying to make sure you have a good budget that reflects the priorities of the state and the needs of the state. And so whatever we do going forward, we've got to figure out a way to pay for it and not wreck the entire budget and take away from other areas. And so that's all going to be part of the discussion with the corrections in the prison.
Yeah, so give me one thing, I guess, that you think needs to be funded in the prison situation, in the overpopulation problem. One thing.
Well, right.
Go ahead.
Right now, one of the things that I know has been discussed, we're talking about doing a $100 million prison, but also, there's 600 beds that we could probably open up in existing prisons and find money to staff that.
Where does that money come from?
Well, that's just one of those things we'll just have to address, because
the pillow?
Yeah, the tooth fairy, exactly. But the new forecast will be coming in here pretty soon. We'll exactly see where the new money's at within another month here, and we'll just start working through it.
One of the things that I like are there's some cooperations with businesses where businesses have gone into different prison systems and different states that we're looking at, and they've really utilized that workforce. So you've got a job training type program going on, so then when prisoners leave prison, they actually have a job skill. And I think that's so important that we look at those different models and figure out ways that we can generate revenues. I mean, I live in an area where Calico Rock Prison, they generate a lot of their own revenues. They have cattle, they have gardens, they have different things. The best peanut butter and jelly sandwich you'll ever eat is from that prison, and I've eaten them there before. So we've got to look at smart ways.
Because you were visiting, or because you were a prisoner?
They have a great work program.
Okay,
they give a lot of work to our counties and our cities there.
See, now you already saw bipartisan support, because I actually support all that. Like you said, I'm 100% on board.
Okay, well, I still am curious as to where the money comes from.
Me too.
That will be the big challenge for you. Maybe growth revenue, perhaps?
Oh, I think so, yeah. I think growth revenue, and then being able to responsibly put that money aside to pay for anything moving forward. That's a smart way to do it.
It's going to be a hard sell to start going in and slash and burning state agencies.
Yep.
I've got to end it here, but I want to get you guys to stay for just a few more minutes, and we'll take our conversation online for some talk about the private option. You do that?
Yes.
All right. We're going to come back from this break. This is Senator Missy Irvin, Representative Jett. You can catch them online at talkbusiness.net for an extended conversation after the show ends. And welcome to our web extra here. I am with Representative Jett and Senator Missy Irvin. We're continuing our conversation from the TV show online here. Let's talk about the private option. It was a big debate this week, particularly down in the State Senate and the Public Health Committee that you serve on, Senator. Is the private option and the bills that you voted on and what came out of committee, is it going to end in 2015? Is it going to end in 2016? Or is it going to continue past 2016?
It's going to end in 2016.
Okay.
It's really a different philosophy of how you kill it. And that's basically what we had presented. And there were two different approaches. And one is to end it soon, and the other one is to end it in what I think is more reasonable time frame. When you're dealing with Medicaid and you're dealing with hospitals and doctors and nurses and speech therapists and physical therapists and all the people that are part of the Medicaid system, you have to wind things down in a slow and reasonable and effective way instead of just crashing it and burning it.
So concerned that there'd be some waiver violations too.
Waiver violations, but also how that transition is going to work with both the people on it plus the people that are providing the services for it. So, I represent rural Arkansas, and that's a really big deal. A lot of these rural hospitals and the people out there in rural medicine really kind of live or die by Medicare and Medicaid payments when there's not a lot of insurance payments involved. So I think it's a reasonable approach to really end it in an 18-month time frame, which is actually what we were presenting in 2014 fiscal session.
Do you see any trouble in the House with the Hendren bill that's making its way down there? And what do you think of the appropriation bill, 75%?
Yeah, I mean, as always, that's a heavy lift. But back to the senators, I'll agree. I think that Medicaid needs to be overhauled, in a reasonable manner. And I think as long as we do this thing in a reasonable manner, and I think the task force, I look forward to hearing the discussion on that. And but the 75 vote is a 75 vote, and that's always a tough lift.
You think it's there right now, 75?
I think so. I think so. Yeah. Last week somebody said on the tax cut, somebody said, "Can you get 75?" I'm like, I told the governor, it's going to be a tough lift. We come in with 90-some votes on it. So, what do I know?
Yeah, you're just the
can
chairman of a
change every
committee.
day.
So. All right, so I don't think that there is a secret that there is some correlation. If the task force has to get its work done by the end of 2015, let's assume that the bill passes, and because there does seem to be some building consensus there. With this end of the private option towards 2016, in 2017, a 1332 waiver, which would be very complex and complicated, could basically allow the state of Arkansas to treat their Medicaid funding almost like a block grant.
Right.
No individual mandate requirement,
Right.
no employer
Right.
mandate requirement. You
Right.
could really redesign
Sure.
healthcare in Arkansas, at least government-funded healthcare in Arkansas. Is that the goal, do you think?
Oh, absolutely. I think that's the goal, absolutely. And I think we've got to make sure at the end of the day that we are streamlining the system, making it efficient to where those that are providing the service are able to provide it in a great way that really treats patients and makes a difference in their lives.
You guys are not doing a loud enough job of messaging that the 1332 waiver is the goal
No,
of the
I
task
would
force there.
agree
I
with
would agree
that,
with that
though.
also.
I would agree because a lot of times things change so rapidly with the federal government and the state government, and the way those funding sources go back and forth, and the FMAP and all of that. And so it's a very, very complicated issue. But at the end of the day, we've got to focus on having a heart and caring for the people of the state of Arkansas, and for the population that Medicaid was an intended
Right.
program for, which is the frail, the elderly, the children, pregnant ladies. But really, it's a small population. And if we do our job appropriately in all the other areas of government in creating jobs and making sure our economy is strong, then that population dwindles just because we succeed economically. That's our goal.
And then we get less money from the federal government because there's fewer people on Medicaid, too.
Absolutely.
Yeah.
So we need to create jobs, and it will help our problem.
All right, so there's 100 House members down there, and there might not be 100 spots on this task force if it comes into law and is turned in there. How badly do you want to be on this task force, Jeff?
The speaker told me the other morning he had 100 people trying to get on this thing. I said, no, you don't. You got 99 because you put me on it, we're going to have problems. So, but I'll just say back to what the senator said. I would say that, we need to be proactive instead of being on defense on this thing. And the 2017 waiver is coming, so we get ahead of this thing. I think it's a good move.
All right, you want to be on the task force?
Well, I represent 9 counties, which is the most of any senator actually right now.
You know a little bit about healthcare?
I know a little bit.
From a medical family
Lived in
there?
Mountain View, Arkansas. Shout out to my folks up there in Stone County. But rural medicine has been a passion for my husband and I for 17 years. That's why UAMS recruited us to begin a rural residency program there. So, I know rural medicine and rural hospitals, but
You know urban too, your dad?
I would say this, whether you're on it or not, our legislature does not close anybody out. I mean, if you're on a committee and you're not on the committee, it doesn't matter. You still have the opportunity to come and participate and be on those different committees, ask questions. But yes, I would look forward to being able to help with that.
All right, Senator Dismang, did you catch that? All right, we'll see about that.
I like revenue and
Thank
tax.
you.
I'll stay.
Yeah, you'll stay there. All right, Senator Missy Irvin, Representative Jett, thank y'all both.
Thank you.
Thank you very much.
Thank you so much.
And you can keep up with the latest business and political headlines each and every day at talkbusiness.net. Thanks for watching. That's our Web Extra. We'll see you next time.